Saint Lucia recorded COVID-19 case number 1 last February. Fast forward 11 months and more than 1,000 cases have been confirmed to date. Lockdowns and curfews kept the infection rate low during the first wave of the pandemic. Restrictions on everything from social activities to public transport became the new normal. International travel resumed in June. Still, the COVID-19 infection rate was contained. That all changed in the fourth quarter of last year. The volume of COVID-19 positive diagnoses spiked. Authorities attributed the second wave surge to protocol breaches and non-compliance, illegal entry, and reopening the borders to international travel. This January is the worst month on record, registering several COVID-19 related deaths, nearly 600 infections, and confirmation of the discovery of the UK variant spreading on island. Saint Lucia officially surpassed the grim 1,000 COVID-19 case milestone on January 27th. The Ezra Long Laboratory confirming another batch of 60 positive cases. Only Barbados in the Eastern Caribbean has racked up more than 1,000 COVID-19 cases. St. Vincent and the Grenadines is also likely to hit the 1,000 case mark after St. Lucia. Testing remains a concern for St. Lucia. January's third wave further exacerbates the island's testing deficiencies.
With this surge, which is almost consistently high, with the daily numbers being within the 40s to 50s, we've been finding that we've been getting a lot more samples, and this has increased our turnaround time to almost 4 days. It's forced us to look at our processes from sample collection at the various sites, from reception of samples, from the mere processing, the analytical aspect of it, and then the delivery of it, and just look at every single system and see where we can develop efficiencies and how we can reduce that and bring it back to the 12 to 24 hours that we've had.
Less than 24,000 samples have been conducted since the start of the pandemic almost a year ago. Experts suggest the true number of COVID-19 cases could be much higher.
There are ranks of priority, and when we say ranks of priority, we know that everybody is a priority, but there are persons who are more severely ill, and it affects also different workplaces, the workflow at the hospital, persons who are traveling. So we try to organize some level of priority for these people. But we push through as much as possible. To date, we process almost between 250 to 300 samples per day. That should increase over the next 24 to 48 hours.
The rollout of COVID-19 vaccines has inspired hope. St. Lucia is on course to receive enough doses to immunize up to 20% of the population. But that still won't be enough to achieve herd immunity. Rihani Isidore, NBC Prime.